Let me change my filter. As I wait for y'all to join. Yes, let's bring the focus to me today. Pin my comment. I'm gonna wait for a couple of more people to join us. I'm gonna find and then we can get started. Hello, hello, hello. Guess we won't do a filter today. Welcome, welcome, welcome. Just stick around for a little bit and I'll get started on Women Wednesdays. Today we're talking about periods, period sex, and menstrual health. Hello. So nice of you all to join us. For those of you who don't know, my name is Soul. I'm one of the social media influencers for the community health team, as well as one of the art educators for the corner, which I am currently in the office. Yeah, and I'm gonna get started on today's topic in just a few minutes. This is also a time for us to remind you all that the BAG series is tonight. The BAG series, aka the Badass Girl Group, creates a space for women to gather virtually, to unwind, to learn from one another, and together we'll experience musical selections from DJ Sean Don tonight and talk through sexual health catered to women. We'll cover everything from clitoris and strapping up to foreplay, lube options, and HIV prevention. Just so you know what we're in for, we break the bag up into 2 rounds. The first round is 30 minutes of music, then 15 minutes of sexual health talk, and then another 30 minutes of music and another 15 minutes of sexual health talk. We invite all women to join us. Yes. We will invite all women to join us and to contribute to the conversation. So it's gonna be amazing. Again, my name is Soul. My pronouns are she, her, hers. You can also use they. Today we're going to be talking about periods, period sex, and menstrual health. So let's just get right into it. Your menstrual cycle helps prepare your body for pregnancy every month. One second. Let me make sure I have the appropriate notes. Yes. Okay. Today we're going to be talking about periods, period sex, and menstrual health. This is for all of our viewers who have uteruses, vaginas, ovaries, and fallopian tubes. Our menstrual cycle is what helps our body prepare for pregnancy every month. It also makes you have a period if you're not pregnant. Your menstrual cycle and your period are controlled by hormones like estrogen and progesterone. And here's how it all goes down. Generally, you're born with 2 ovaries. Each one holds a bunch of eggs. The eggs are super tiny and too small to see with the naked eye. During a menstrual cycle, hormones make the eggs and the ovaries mature. When an egg is mature, that means it's ready to be fertilized by a sperm cell, and these hormones also make the lining of a uterus thick and spongy. So if the egg doesn't feel fertilized, it has a nice cushy place to land and start a pregnancy. The lining is made of tissue and blood, like almost everything else in our bodies, and it has lots of nutrients to help a pregnancy grow. About halfway through a menstrual cycle, the hormones tell an ovary to release a mature egg, and that's called ovulation. Most people don't feel it when they ovulate, but some ovulation symptoms are bloating, spotting, or a little pain in the lower belly that may only be felt on one side, similar to cramps. Once the egg leaves the ovary, it travels through one of the fallopian tubes and towards the uterus. If the pregnancy doesn't happen, the body doesn't need the thick lining in the uterus, and therefore the lining breaks down. The blood and the nutrients and the tissues flow out of the body through the vagina and possibly front hole. Voila, that's a period. If a person does not get pregnant, the body needs that lining, and that's why periods stop pregnancy. A period comes back when a person is not pregnant anymore. So when in life do periods start and stop? At some point during puberty, blood comes out of the vagina or front hole, and that's a person's first period. Most people get their first period between 12 and 14, but some people get them earlier or later than that. There's no way to know exactly when you'll get it, but you may feel some PMS symptoms a few days before it happens. If you have a uterus and you don't get your period by the time you're 16, it's a good idea to visit your healthcare provider and check in with them. Most people stop getting their period when they're about 45 to 55 years old as well, and this is called menopause. Menopause can take a few years, and periods usually change gradually during this time. After menopause, it's totally complete. A person can't get pregnant anymore. Your period may start and stop around the time it did for other people you're related to, like your moms and your sisters. So it's important to keep talking to the people around you, your family, your chosen family, about your experiences so that you can learn from each other. Do trans people get a period? Not everyone who gets a period identifies as a girl or a woman, and not every woman gets a period. Transgender men and genderqueer people who have uteruses, vaginas, fallopian tubes, and ovaries may also get their periods. Having a period can be stressful for some trans folks because it can be a reminder that their bodies don't match their gender identity. This discomfort and anxiety is sometimes called gender dysphoria. Other trans people might not be too bothered by their periods, and some trans people might wish they could have a period. Every reaction is normal and okay, and it really depends on that individual's personal health journey. Some trans people who haven't reached puberty yet take hormones called puberty blockers to prevent all of the body changes that can happen during puberty, including periods. And people who already get periods can use certain types of birth controls that help lighten or stop their period. Hormone replacement therapy, like taking testosterone, may also stop a person's period. Talk to your medical provider if you'd like to know options for stopping your period. If you'd like to, or you already started taking testosterone, your period may go away, but this is reversible. If you stop taking testosterone, your period will come back. There can be some changes in your cycle before it stops for good. The bleeding may get lighter or shorter over time, or come when you don't expect it. You may have spotting or cramping every once in a while until it goes away, and sometimes even after it seems to have stopped. This is normal. Testosterone injections may make your period go away faster than testosterone cream. If you're experiencing gender dysphoria when you bleed every month, know that you are not alone, and it may be helpful to check out resources and find a trans-friendly doctor in your area that you can talk to. You can feel free to contact Whitman-Walker's Gender Affirming Care Team at transhealth@Whitman-Walker or call 202-797-4457. Thank you all for joining and for supporting me as we have this conversation on this live, and for supporting Whitman-Walker. So let's talk about period sex. During your reproductive years, you'll get a menstrual period about once a month. Unless you're especially squeamish, that shouldn't be any reason for you to avoid sexual activity while you're on your period. Sex while bleeding can be messy, but it is safe. Having sex while on your period can have some benefits, such as relief from cramps, shorter periods, and an increased sex drive. It's good for natural lubrication, and it can help with relief from headaches. I have a few tips on having sex during your menstrual cycle. Be honest and open with your partner. Tell them how you feel about having sex during your period and ask how they feel about it. If either of you is hesitant, talk about the reasons behind the discomfort, and just make sure that both parties involved are comfortable with doing it and the experience. If either of you have explicit boundaries for sex while bleeding, make sure you're discussing that ahead of time. If you choose to have sex while on your menstrual cycle, make sure if you do have a tampon in, you remove it before you start engaging in sexual activity. You can spread a dark colored towel on the bed to catch any blood leaks, or have sex in the shower or bath to avoid the mess entirely. Make sure you keep a wet washcloth or wet wipes by the bed to clean up afterwards, and shower afterwards. Clean yourselves and your bodies. Use a barrier that makes sense for the kind of sex that you're having. Consider a dental dam, or have your partner wear a condom. It'll still protect against pregnancy and STIs. If your usual sexual positions are uncomfortable, try something different. And for example, you might want to try laying on your side with your partner behind you. Note. Can a person get pregnant during their menstrual cycle? A person has the highest chance of getting pregnant on the days leading up to ovulation, when the ovary releases a mature egg. These are called fertile days. Ovulation can happen about 14 days before the period starts, but everybody's body is different. A person may ovulate earlier or later depending on the length of their menstrual cycle. An egg lives for about 1 day after it's released from an ovary, and sperm can live in the uterus and fallopian tubes for about 6 days after sex. So a person can usually get pregnant for around 6 days of every menstrual cycle. The 5 days before they ovulate and the day that they ovulate. They can also get pregnant a day or so after ovulation, but that's less likely. Many people track their menstrual cycles and other fertility signs to help them figure out when they're ovulating. You can use an app. You can, mark it on your calendar. That's called Fertility Awareness. Some people use it to prevent pregnancy. Others use it to try to get pregnant, and other reasons. But it's good to stay in tune and to know what's going on with your body. Some people have very regular cycles, and other people's cycles vary from month to month. So it's really common for young people to have irregular periods. Since periods can be unpredictable, it's hard to know for sure when someone might ovulate, even if they're carefully tracking their menstrual cycle. So to avoid pregnancy, consider using birth control and contraceptives every time that you engage or in inserted vaginal front hole sex, where sperm may also be present. Just make sure that you're adding to your sexual health toolkit still. Period sex is healthy, it's safe, and as long as you are comfortable with it and you are still continuing to use the barriers and contraceptives, you should be good to go. Thank you so much for joining me today, and remember to follow us on at Whitman-Walker on Facebook, Twitter, IG, for more sexual health education and the most up-to-date information about Whitman-Walker Health Services. Also, do not forget that tonight is our bag series at 8:30. I'll be back to remind you all at 6 o'clock. And again at 8:15 with DJ Shondon to give y'all a sneak peek as to what the bag series and the grooves will sound like. But we'll have a more casual conversation about periods, period sex, and our menstrual health. Tonight at 8:30 for the bag series. RSVP on the bit.ly form. It's going to be a good time. See you later. Thanks.